Finance Committee meeting. Pursuant to the Illinois Meetings Act, meetings held remotely will require roll call votes for all action items. Streamlined, we've combined the action items into one combined motion, hopefully. So only one will hopefully be new. One roll call vote will only be needed during the meeting. Excuse me, I've got a sudden cough this morning. Will the secretary please call the roll?
Director Deere?
Deere is present.
Director Harrington?
Present.
Director Story?
Present.
Director Curry?
Did you say Director Curry?
I did. I actually meant to say, for the record, those directors also present. Director Curry, I do see him here. Director Curry,
I am here.
present?
Yes,
Thank
I
you.
am. Yes, present.
And Director Robinson.
Present.
Thank you.
And I'm also here. I didn't hear my name. I'm here as well.
Chair Ryder, I'm messing this up this morning. Sorry.
That's all right. Thank you. The next regular meeting of the Finance Committee is scheduled for Thursday, March 23rd at 9 a.m. Is there, Debbie, is there any public testimony?
No, we did not receive any.
I'm going to first start with the meeting, the January 19th, 2023 Finance Committee meeting minutes. These were approved by the board at the January meeting, but are being presented for the committee's review and discussion if necessary. Are there any corrections that need to be made to the minutes? Any corrections? Any corrections? Hearing none, we're going to hold these minutes for the combined motion that we intend to present at the end of the meeting. Now we're going to move to items under the Chief Procurement Officer. The contract procurement items. There's a total of 18. Has been our practice the last several months. The individual contracts are going to be presented by the contract sponsors if available. Otherwise, we'll have Charles, our Chief Procurement Officer, and any other staff pinch hitting. So first up are items 1 and 2, which are being presented by the Cook County Department of Public Health, Dr. Lamar Hasbrook. Dr. Hasbrook, are you ready to go?
I'm ready to go. Thank you. Good morning. So good morning, directors. So I have 2 for you. The first one, I should note that there is a sponsor in the upper left-hand corner. This sponsor will be Dr. Alfreda Holloway Beth. She runs our epidemiology unit. This is for an extend. I'm sorry. Okay. This is for an extended increased contract. The vendor is RTI International. It's for the amount of just over $960,000 grant funded. It is to extend for a period from June to December, 6-month, 7-month period or so. And it is for the purposes of conducting the Cook County Health Survey. This is an annual commitment. Surveys the Cook County, 32,000 residents, and it's to get information on community health assessment. We have gone with this contractor specifically because they've actually been doing a similar study for the city of Chicago, what they call their Healthy Chicago Survey. They have great expertise in this area, and we want to make sure we have alignment and coordination with them as the data from these studies will go into our health atlas, which is also very similar to the city of Chicago's atlas and allows you to compare apples to apples. So that's why we're going sole source with RTI International for this endeavor. Any questions? Okay, if not, I'll go to the next one. The next one is an extend and increase. It is for the vendor BCT Consulting. They've been with us for several years. They do our website hosting, maintenance, and design. And we wanted to put this through a competitive process. So we had an RFP go out in 2022. This is just to give us a bridge, another 5 months or so, 5 or 6 months, so that we can get the new vendor on board without any disruption of our current website. So this is a very short-term extension pending this RFP competitive process. Any questions on this one?
Any questions for Dr. Hasbrook? All right,
Great,
thank you, Dr. Hasbrook. We're now gonna move to the item number 3, health plan services, being presented by Aaron Galiner, our Chief Administrative Officer. Aaron, you there? Not hearing Aaron.
Chair, I don't believe he's here.
Okay, Charles, do you or someone else from Health Plan Services want to walk us through number 3?
Yeah, that's fine. I can take it. Good morning, Charles Jones, Chief Procurement Officer. This request is to extend the contract with First Transit, which does Medicare non-emergency transportation services on behalf of the Health Plan Services. It's the no physical impact, as we're just doing a 12-month extension for time only, so they can continue to provide non-emergency transportation services to our Medicare members. Thank you.
Great. Any questions for Charles on this contract? Hearing none, we're going to move to items 4 and 5, ambulatory services, being presented by Ileana Mora, our Chief Administrative Officer for Ambulatory Services.
Good
Ileana?
morning. Yes, good morning. This is Ileana Mora. I'm presenting the favorite contract. It is for our refugee health services. They are providing the clinical support staffing needed to deliver the care we have started back in September. A portion will also go to pay 2022 outstanding payments. The contract is through a comparative government purchase from the state of Illinois. Next contract is for Chicago Lighthouse of the Blind. They currently provide for us backup call center support for overflow of our own call center. In addition to that, we're going to be asking them for support in making calls for our health risk screenings for new county care members that are in panel to ACHN. The contract will also include outbound calls for patients who have gaps in care, and will be reminding them and making appointments for to fulfill their gaps in care and ultimately improving their health outcomes and our HEDIS measures.
All right. Any questions for Ileana on either 4 or 5? All right, hearing none. For the next several, I know Dr. Claudia Fegan, our Chief Medical Officer, is involved with these next 3 at some level with other folks as well. So we're going to go to request number 6 through 8, and Dr. Fegan, will go to you, and then anybody else who needs to jump in.
Thank you, Chair. So this first one is for repair and maintenance of scopes. We use these scopes. This is primarily in the emergency department, not emergency, in the operating room. This is so that those scopes can be properly cleaned. When they are not able to be repaired, they are replaced. And so this is the processing of these screens, which is processing of these scopes, which is really important.
All right. If there's no questions, we'll go to number 7. Dr. Fegan and Ileana.
Yes, so this is for the provision of, we're looking to provide additional support for our psychiatric, our behavioral health, as well as providing additional staffing for anesthesiology.
For ambulatory care, this includes the medical providers that provide medical care and the medical assessments for the refugee health center. Once we get them credentialed for primary care, they will also help support the gaps in staffing that we have in primary care.
Any questions? If not, we'll move on to item number 8, Dr. Fegan and Angela.
I do have
O'Baniak.
one question, Mr. Chair. I do
Sure.
have one question, Director Deere. Who is this contract with? Is it with these particular providers?
It's with Maxon Physician Resources.
Okay, so that's the organization.
Correct.
And on this particular contract, are we requiring minority business with this?
I can answer that. Good
Yeah,
morning,
okay.
Charles Jones, Chief Procurement Officer. Yes, Commissioner Deere, all contracts go to the Office of Contract Compliance for a contract-specific goal to ensure that they're responsive.
Okay, and do we know what that goal is for this one?
I could tell you this in a second. Yes, this actually is a zero goal because there's no one certified in the county or the city.
So nobody's certified that does this work?
In the area of locum tenens, which is specialized physicians, PAs, clinical providers, so on and so forth. No, sir.
That's interesting. I find it hard to believe, but I'm gonna believe you. But I do find it hard to believe that there are no certified vendors that can do this work. But I'll do my own due diligence around that as well. It's hard for me to believe.
Here's the issue, Dennis, is that, if there are no certified vendors, I mean, that's a matter of fact.
Indeed.
If there are people out there in the city or county that do this work and have not gotten themselves certified, I'd be shocked considering how much work we do in the space on diversity and the amount of effort that we put into making sure that we're recruiting agencies to do it. I think the thing that probably, that could impact this is the specialty that is required, which sounds like a specialty, but it's actually a pretty broad area within that specialty of people that do these jobs. So, it's all we can do is encourage people to get into the space in order to do it. Now, that also does not mean, as with any of these, that we're not going to get diverse candidates. It's just that the agency itself is, the owner, the people who own the agency. We don't have business owners that are diverse in the space. Doesn't mean that we won't get diverse candidates that will fill the positions.
Understood. I get that wholeheartedly, Mr. Chair, but also there's also accountability to that business to go out there and find individuals that they can partner with who are for minority communities and actually do this work. I think that's that's the expectation that we have. If it's not any there, do your due diligence effort to find it.
Yep, and we can.
Which I'll circle back and certainly do.
Yeah.
I don't like to take this at face value, which is why I posed the question.
Yeah, no. And for sure, we should always be, doing that. But I do have faith that Charles is doing the work to support this.
Oh,
So.
not this ain't on Charles. I believe Charles is doing his work. But as one of the old quotes go, trust but verify.
Yep, I hear you. All right. Any other questions?
Thank you.
Yep. Any other questions on the locum tenens contract? All right. That was number 8, right?
Number 7.
Oh, number 7. Okay, number 8. All right. Oh, okay. Number 8, Dr. Fegan and Angela.
Yes, this is this is a contract to look at medical necessity using the guidelines in terms of assessing indications for hospitalization, making the justification for patients who are hospitalized, seeing that we meet the standard. There are minimum guidelines in terms of which diagnoses justify how long patients are hospitalized.
All right. Any questions? Hearing none, let's move to request number. Let's move to request number 9 through 10, which are going to be presented by Shannon Andrews, our Chief Equity and Inclusion Officer. Shannon.
Thank you, Chair Ryder. The next two items in front of you are being presented by the CPO and I. This is a request to exercise the first of two one-year renewals with Medline Industry. They are a product for primary distribution of medical and surgical supplies. This extension would include the extension and an increase in the amount of $9 million. And this vendor provides us with medical, surgical supplies and products. Charles, could we scroll down a bit, please? I want to make certain I get the total time there. Yes, and so this will take us from May of 2023 to May of 2024. This was the result of a GPO competitive selection process where we received 4 proposals. The next item is the result as well of that solicitation, and this will be the exercise of the first of 2 one-year renewal options, not to exceed $1,250,000. The time frame would take us from May of 2023 until April of 2024. And if there are no questions, thank you.
Any questions? All right. Moving on. The next item is item number 11, being presented by Pam Cassara, our Chief Financial Officer.
Thank you, Chair. This one is for presented by myself and Chief Revenue Officer Curtis Haley. It is for revenue cycle. Guidehouse provides us with revenue cycle support, and this was awarded through RFP. And I believe if you scroll down just a little bit, this is the first of 2 one-year renewal options. Any questions?
All right. Hearing none, let's move on to item number 12, which is being presented by Jeff McCutcheon, our General Counsel.
Good morning. This is an extend and increase contract with our outside counsel, Hall Render, that are helping us review our clinical trial. The bulk of this increase is related to the expenses for our outside consultant, Huron, who are going to help us create and then initially staff our Department of Life Sciences, which will oversee all of our clinical trial and research. The idea is to get them in here and working immediately so that we can restart clinical trials as soon as possible.
Mr. Chair,
Any
I have
questions?
a question. Mr. Chair, Director Deere, Jeff, at some point, and thank you for this, because it's certainly timely, and I'm glad we're working through this. At any point, will we get a presentation on this board about the intended work of these particular groups with the Life Sciences Division? Just what they found, what they're anticipating doing, and the processes?
We can absolutely do that. I think the appropriate time to do that would be once they've helped us work out exactly what the life science department should look like and who the employees, what jobs should be included in it. I think that would be something absolutely we could present.
And just for a point of clarification, this is the work that's currently being done over at CORE and other places?
That's Yeah, we do clinical trials in various places within the organization, but it absolutely does include work being done at CORE.
Good. All right, thank you so much. I definitely look forward to that.
All right, thank you. Any other questions for Jeff? Hearing none, we're back to Angela O'Banion for request number 13 and 14 on health information systems.
Good morning. This request before you is to extend and increase a service that we use by a company known as Breakaway Promise Point, which is now owned by Atos. You may recall that it came before you and was approved an Atos contract, which we intended to roll this one under. However, due to intellectual property language that is in this contract that is not in the master agreement, we were counseled to keep this one separate and simply decrease the previously approved contract by this amount. This Breakaway Promise Point software is instrumental in helping to create education and various tools for our clinical team.
All right. Any questions on this item? Hearing none, let's go to the next.
The next item, which as you can see, is also extended and increased through our GPO vendor CDW for DocuSign services. The DocuSign services that we use here in the hospital system include dozens of workflow management improvements throughout all of our various programs and transformational projects such as HR, some patient facing registration, et cetera. We use DocuSign in those instances. Most people know DocuSign for the signatory process, which we also use it for, and we are expanding the use of DocuSign to include these supply chain management, contract management, transformational work.
All right. Any questions on that item?
Thank you.
Moving along, we're going to item 15, Human Resources, being presented by Valerie Amos, our Chief Human Resources Officer.
Good morning, Chair Ryder. This is Valerie Amos, Chief Human Resources Officer. I have one contract before you. This contract is with Cross Country, who has been providing recruitment services, as well as marketing campaigns to assist with promotion of Cook County health employment opportunities. And they've also been supporting us with job fair coordination. As most of you have seen, we have been hosting monthly job fairs, as well as accelerating hiring. And we still have a ways to go. So this contract is to extend and increase. Any additional questions? Thank you.
Thank you, Valerie. Okay. Moving along, our next one is going to be Operations and Development, 16 and 17, being presented by Craig Williams, Interim Chief Administrative Officer for Operations and Development. Craig?
Thank you. Good morning. This is Craig Williams. The first contract is with Cepheid. It's an amend, extend, and increase contract for a total of $1,257,250. Extensions for 3 years through 9/30 of 25. The original contract was for 3 years, ended 9/22, and was sourced through our GPO. This vendor provides reagents and instrument maintenance for our PCR testing in our lab. This system provides fast turnaround times and improved accuracy of results over other type of testing. And the contract will also include our PCR COVID-19 testing. So it actually is combining two contracts into one. Any questions on that? Okay. The next one is for Dixon. It's also an amend, extend, and increase contract for a total of $145,674.50, which was a correction over when the transmittals originally went out. The confusion was the original contract was a 12-month contract totaling $457,100. $179. This was to provision equipment, installation, and software licenses, so we could monitor temperatures across all the refrigerators within CCH. We haven't completed the project, and there remains about $50,000 on the original contract. In order to finish, we also have identified additional sites that need this temperature monitoring, and so we're requesting to extend the contract and increase to cover those additional sites. Thank you.
All right. Thank you, Craig. Our last item number 18, Provident Hospital, being presented by Dr. Arnold Turner, the Chief Hospital Executive. Dr. Turner.
Thank you, Chair. This contract is with Bayer, the vendor, to provide ventilators for our intensive care unit, which we reopened in April, and to replace the Philips ventilators that we have that will recall. In addition to providing the invasive serving as a ventilator, this unit can also have a non-invasive used as providing another respiratory support known as BiPAP. So that will also allow us to extend our respiratory services in the hospital, not only intensive care unit, but also on the med-surg floor. Any questions? Thank you.
Thank you, Dr. Turner. That's it for the contract items that are going to be presented. Charles, is there anything else you'd like to say before we on request number 1 through 18 before we move on to the next part of your report?
Yes, sir. 17 of those 18 contracts require responsive letters from the Office of Contract Compliance for their MWBE participation. We have 11 back, so there's 6 outstanding. Thank you.
All right, great. Next on the agenda, Charles is going to report on the fiscal 2022 Q4 report of contracts executed under the CEO's authority, which is contracts under $150,000. Charles, go ahead.
Yeah, what you have before you is the final quarter, the Q4 of fiscal year 22, September, October, November. I won't go, it's 2 pages, 35 contracts total. I won't go through them all individually, but little synopsis, they're all in alphabetical order too, not necessarily in the order of when we executed them. But, 6 of these 35 are GPO vendors. We had 3 capital equipment purchases. 8 of them was for refugee health, refugees health assistance at our Belmont Cragen site. And about 13 or more of them was grants on behalf of the Department of Public Health for the Building a Healthy Community and various other grant-related activities. Any questions?
Questions on any of that? If not, let's go to the report of emergency purchases.
In the month of January, we notified the chair of the board of directors and the chair of finance of 2 emergency purchases on January 27th, the one for Lavin Consultant LLC here for a 5-month period to evaluate the hospital-wide infection prevention and control programs, including policies and procedures to assist with the Joint Commission readiness at Provident Hospital, $45,760.
Any questions on those?
And then on January 26th, the Board of Trustees for University of Illinois and UI Health, a 12-month contract for the Department of Gynecology for the provision of urogynecology physician services, $149,000 there.
All right. All right, I think we can move on to the timeline on the RFP process and transition for GPO services. Charles?
Yes, thank you. So first, next page, Debbie. So first and foremost, this is an open solicitation. So we won't go into a lot of specifics about the RFP itself based on code, but we thought here for just a few new board members and all, so we thought it would be beneficial to give a brief definition on overview of what a GPO is. GPO plays an integral role in the healthcare supply chain ecosystem, providing access to contract portfolio pricing, resources, support, tools, and other services for all healthcare systems. So here in the middle, you see that they are an organization that consolidate the spend for all of its members for contracting pricing, leveraging combined volumes for greater purchasing and negotiation. And they earn their revenue through administration fees. To the left, some of the services, excuse me, that they provide: contract pricing across multiple categories from mid-surge, commodities, drugs, food, capital equipment, purchase services, so on and so forth. They have benchmarking tools. Our quality department uses clinical database, operational database, and performance improvement within the Department of Business Intelligence. In supply chain management, we use tools like pricing actualization to do price analysis. They provide a dedicated resource to us that's at our leisure to be used throughout the duration of the contract. Some of the benefits that they offer, administrative sharebacks. On average, most of the members, the suppliers and the service department, the service vendors that utilize it pay about a 5% fee. But we as a member that utilize those companies, we don't pay anything. We receive administrative fee back. So it's pretty much revenue generating for us. We receive a membership fee anywhere from 1% to 3% back, depending on which GPO we deal with. We receive better pricing and values and other value added offered through the membership. For instance, our facility is classified as an academic medical center, an AMC, which automatically gives us a certain tier of pricing right off the bat before we get into the other tiered pricing that's based on volumes and expenses. Purchasing volumes and our spend. They reduce elements of administrative and contracting burdens and all with us with doing contracts to make ease of business with doing our contracts, because since the GPO goes to an RFP process and they vet the vendors, they do contract language with the vendors with all the services that needed to be provided. It ends up being kind of standardization with contracting. And then, as mentioned earlier, we have access to a lot of the tools. Next page, Debbie. So here for our specific timeline, we broke it down between 4 phases: the RFP preparation, the evaluation preparation, the RFP review and vendor orals, and then selecting and contracting. During the preparation phase in December and January, we reviewed, got everything together for preparation and release, and prepared our market baskets and all to be posted. We posted the RFP on January 13th of this year. Then during the evaluation preparation, we're working with finalizing our evaluation committee, working with GPO objectives and timelines, looking to align on objectives of the GPO selection. So right now, currently, we're in our 3rd phase, the RFP review and vendor orals, which we expect all the responses due sometime before close of business today. And with that, we'll analyze and probe the GPO responses. We'll have each vendor in for Q&A, if necessary, in person, Q&A and vendor presentations, and then work with the EC committee on the scoring, engaging in the oral presentations. And then our targeted outcome there is to finalize the GPO selection recommendation no later than March 20th of this year. And with that, that takes us to the final selection and contracting. Again, from March 20th onward, if everything stays on track for us, we look to finalize the selection, enter into agreement, and potentially present to the board sometime in the April-May timeframe. Any questions on this page before we move to the next page? Okay, hearing none. So, as we're always looking to grow our MWBE participations, I know that we're looking to increasing and growing. I just want to make sure and highlight for this RFP for the selection of a GPO, it does not have an associated MWBE goal because the solicitation will result in an award that is revenue generating for us. However, I'd like to point out that each individual contract that we do with a GPO member, when we're doing a spend, when we're buying a product, we're buying a service, we're buying a piece of capital equipment or whatever, those contracts will have to go through the Office of Contract Compliance like any other procurement and any other spend, and we request a contract specific goal to support that procurement spend. Any questions? Okay, hearing none, turn it back over to you, Chair Ryder.
Thank you, Charles.
Yes, sir.
With no questions for Charles on any of that, we are going to move to items under the Chief Financial Officer, Pam Cassara. I believe we're starting with the receipt and filing of grant award related items.
Sure, thanks, Chair Ryder. So you have before you the list of the February receive and file grants. I won't read through them all. They're 3.8 million total. Most of them are amendments. There are three new ones. However, I will point out if there are any questions, I believe the executive sponsors may still be on the phone. Any questions?
Any questions? All right. If not, then we will move on. And Pam, can you present the financials?
Happy to. So for the first month ended December 31, we came in with a 37.0 million favorable variance to budget on an accrual basis, and the county has us at a 49.7, also favorable on a cash basis. That is primarily being driven on the revenue side, a favorable variance to the budget due to some BIPA we received in December that wasn't budgeted to come in until January. For the new board members, BIPA is, I have to read it because I can never remember, the Benefits Improvement and Protection Act, which grants us supplemental payments similar to DISH. So we budgeted those to come in January. We actually received some in December. And then also favorable variance to budget due to higher than budgeted county care membership. And then on the expense side, supplies and purchase services were favorable due to lower volumes than budget, and county care claims expense was unfavorable due to that higher membership again. They came in at a 6.1 million operating gain, and that membership is still over 449,000. Next slide, Debbie. So as we look at the financials there again, I'll just draw your attention, total revenue line, 25.2 million. Thank you, better than budget. And total expense line, 12.4 million under budget or better than budget. So bring into the bottom line there of 5 million. We actually budgeted to be negative 31 million. So the 36.9 million favorable variance. Next slide. So volumes, these are the key volumes. You'll see this year we did break out at the request of the directors and some of the commissioners as well, Provident volumes from Stroger, so that we can kind of zoom in and key activity of Provident. You can see we budgeted an average daily census of 26, and they're almost there at 23. So just 3 patients per day, less than we budgeted and trending in the right direction. But compare that to the last 2 years of average daily censuses of 8 and 7. So again, trending in the right direction and breaking it out, we'll be able to monitor this over the course of the year. And then we have, of course, our go ahead. Yeah, that's fine, Debbie. Our graphs, as we trend the volumes over time, trending to since 2019 up to the present, and what we'll be projecting for this year and then also comparing to our budget. Next slide. Payer mix, again, as we've reported in past, we continue to see the increases in Medicaid and decreases in uncompensated due to the pause on the redetermination related to the public health emergency. This, of course, was just a single 1 month, so I don't think the dip in the Medicaid it's more a function of applications getting processed in the holidays rather than a true decrease. But you can see that the Medicare and commercial I'm sorry, the Medicare, just the Medicare this month is a slight increase as well. Next slide. Revenue cycle continues to do well. They had missed only on one indicator. They had a computer or a system glitch that they are correcting for, but other than that, everything in the green. And the next one, denials. We changed this slide up a little bit for this year. The graph on the left, the reasons and the trending, so that it's easy to see sort of where we're honing in on the types of denials. You can see the big one there in the yellow is related to timely filing, and so we can put resources to trying to correct the underlying reason and keep the denial from happening in the first place. Next slide. And then our charitable and public program expenditures trending pretty close to budget and prior year, and as a percent of revenues and costs, pretty consistent. Next slide. And then our savings initiatives. You can see we budgeted quite a big jump this year in planned initiatives, 47.5 million. 1/12 of that we would be at 8%, but we came in at 4% for, again, just the 1 month of December. Some of those items are in the yellow simply because they're planned or slated to start later in the year, and we anticipate we'll catch those up. And then last slide, county care. And again, the story is sort of at the bottom there with the graph. We budgeted for redetermination to begin and the membership to slowly come down over the course of the year, and it has not, as you know. The redetermination will start about April, and membership will start to fall off the rolls about June, July. So we will have a nice cushion for most of the year with county care. They did also, want to point out, come in at 6.1 million. They budgeted basically a break even or tiny loss there, but that loss, or I'm sorry, that 6.1 million includes the loss from the final month of more care of 1.2 million. So we are now done with more care, and that loss is included in that 6.1. And that is it. Any questions?
Any questions for Pam? Right. Hearing none. Next up, we have the combined motion to accept item 3A, the January 19th, 2023 Finance Committee meeting minutes. Approve item 4A, contract and procurement items containing request number 1 through 18 as amended and subject to completion or review by contract compliance. And receive and file item 5A, the grant award related items. The roll call vote will be needed on this combined motion. Is there a motion?
So moved. Director Harrington.
Motion's been made by Director Harrington, seconded
by Deere.
By Commissioner Dr. Dennis Deere. I'd also like to note that Lyndon Taylor, the chair of Cook County Health, has also joined the meeting. Is there any discussion on the motion? Hearing none, will the secretary please call the roll?
Roll call vote on the combined motion. Aye or nay? Director Deere?
Deere is aye.
Director Harrington?
Aye.
Director Story? Director Story? He may have stepped away. Chair Ryder?
Aye.
And circling back, Director Story, are you present? Okay, you have 3 yays and 1 absent.
Great. The motion passes. Looking at the agenda, it looks like we have gone through everything that we that was set for the agenda. And having exhausted the agenda, our meeting's adjourned. I will see you guys at the board meeting. Thank you.
Thank you.
Thank you.
Take care, everyone.